Hi, I'm Dr. Brandy Patterson. I'm a cardiologist specializing in heart disease treatment and prevention, particularly among women. I've been passionate about exercise, meditation, eating healthy, and taking care of the body and mind for a very long time. As a child in South Florida, I was involved in just about every sport imaginable. However, my true love was dancing. I danced professionally in high school for a modern dance company called Body and Soul. In college, I pursued biology and pre-med requirements while dancing professionally for the Miami Heat all 4 years. After completing medical school and my internal medicine training, I knew that heart health was in my blood. Becoming a cardiologist was exactly what I was meant to do. It was my parents who first made me consider a career in healthcare. My father pitched for the New York Yankees in the 70s. After tearing his rotator cuff, I saw him go through 7 operations and endless days of rehab. He gave me an appreciation for and an understanding of the patient experience. My mother was a professional racquetball player. However, after injuring her back, she turned to nursing. She's the one who showed me all of the good that comes from healing others. I've spent my career striving to do just that. I organized community health fairs in Philadelphia while I was a faculty member at University of Pennsylvania. As the physician leader of Club Red, a women's heart health initiative at University of Virginia, I organized and spoke at community events focused on heart disease in women. Having the opportunity to discuss health and wellness through the media topics on TV has allowed me to share my passion and educate a larger population. I hope to continue making a positive impact on people's lives, both in clinic with my patients, but also out in the community. There's just no tap dancing around the fact that heart disease continues to be a significant health burden in the United States. The best way to change that is through increased awareness about heart disease risk factors and improving overall health. And I am more than happy to spread the word. Hi, welcome to Straight Talk MD. I'm Dr. Brandy P. I'm a cardiologist at UVA Heart and Vascular Center and the UVA Club Red Clinical Ambassador.
So the first goal that I ask patients to consider is what is actually causing the stress, and is there any way that they can get rid of it?
It's true that heart attacks are one of the causes of heart failure. However, it's not the only cause.
Blood pressure is basically the force of blood against the artery wall, and high blood pressure is excessive force against the artery wall. Americans have about a 90% lifetime risk of developing it.
So I always like to ask, what the heck is the good news here? These are things that you can change.
The Heart Age Calculator is a tool that's designed to give us an overall idea of our heart health. And it's meant to be used in people that are ages 30 to 74 years old and in those without cardiovascular disease. So no history of heart attack, stroke, peripheral arterial disease, or heart failure.
Population-based Women's Health Initiative, which examined causes of morbidity and mortality in postmenopausal women, is shedding light on yet another risk of consuming artificial sweeteners. This is a chronic condition, and while there are medications that help some IBS patients, there is no single cure. All of these conditions that I just talked about increase your risk for heart attack and stroke.
The usual method is diet and exercise. We like to do it the natural way if we can, but a lot of times that doesn't work. So then we prescribe medication called statins.
How do you know which one to trust? At UVA Health System, one of our goals as healthcare providers is to educate our community and beyond. But the bottom line is, it doesn't come in a pill. You just got to do it. You may be ready to say goodbye to winter and hello spring. But for many people, the change in seasons brings unwelcome symptoms like watery, itchy eyes, sniffles, and sneezes.
Down so far is 20 to 30 milligrams per deciliter. It's unprecedented. We've never seen anything like this.
You're absolutely right, Casey. The to-do list, the parties, the shopping, while it sounds wonderful, it can be overwhelming. Every time nicotine enters the body, it constricts the blood vessels, raising blood pressure and increasing your risk for coronary artery disease and a stroke. But today, we're going to talk about another kind of heart disease that cannot be prevented. If you're not familiar with it, shingles is a virus that causes a painful, blistering rash. The rash typically resolves in a couple of weeks, but in some people, the pain persists due to lasting nerve damage, and this can really impact quality of life.
Today, we're going to talk about workouts with Will.
In my opinion, the best gift, the greatest gift of all, is health.
When the heart rhythm is too fast or too slow, blood flow is compromised and serious complications can occur. When it comes to a stroke, these are words to live by. That's because the longer it takes to get treatment for a stroke, the greater the impact on the brain.
So what's the good news here? Heart disease is preventable. This is an abnormal heart rhythm brought on by a combination of triggers such as drinking too much alcohol or caffeine, overeating, fatigue, and of course, stress.
It's called the HIIT workout, high intensity interval training.
So even though you're eliminating fat cells and a few inches, there are no proven health benefits.
For many people under 40, hypertension is not on the radar.
Be sure to ask questions. It's okay to ask your provider why a drug is necessary and if there are any side effects.
If high blood pressure remains high over an extended period of time, the heart must work really hard to pump blood.
The surroundings are unfamiliar, and the language, peppered with complex medical terms, can be very difficult to understand. To be at their healthiest, children need at least 60 minutes of physical activity on most, preferably all days of the week. For more tips on kicking the habit, visit quitnow.net. Talk to your doctor about the best strategies to help you meet your individual health goals.
Thank you so much for joining us for this segment of Straight Talk MD.